think we'll go ahead and get started. Good morning and welcome. For anyone that's joining us for the first time today, I'm Linda Hashef, Executive Director of Opportunity Alliance Nevada, and we thank you all for joining us today. It's actually a beautiful snowy day in northern Nevada, and we hope you're all well and staying healthy. We appreciate your time and your continued participation in our meetings. It's really important, your participation, so it's appreciated. Today we have a really wonderful presentation and sharing of information related to rural health networks and coalitions presented by two really great people who've spent a lot of time working in that area. And I very much look forward to their presentation. But right now I'd like to introduce one of our team leaders, Lori Martin, and she will lead us in a moment of gratitude. So welcome, Lori.
Great, thank you, Linda. It is with great love and respect that I welcome each of you with all my heart this morning. So let's take a moment together. I invite you to just take a couple breaths, get grounded wherever you are. I'm seeing names and a few faces. Just taking a few grounding breaths. And this morning, being grateful for friendship and connection. During these times, I think for each of us, those that we love, our friends, our family, have really gotten us through these times. But I'd like to particularly invite each of us to think of a friend who has really been there for us through these times. Someone who's really seen us, maybe not even in person, only on the mosaic in the worldwide weave. Someone who's listened to us through the good, the bad, and the ugly. Someone who's really been there, who's got our back. So think of that person and hold them in your heart. And in our Bridges work, we say it's all about relationship, relationship, relationship. So thinking for ourselves how much that relationship means to us and listening to the voices of those we serve, the ones I listen to on the phone, the messages we receive, the ones that you all maybe actually get to see out in the field, and thinking about how important relationship is for them. And what I hear often is the voices of people who are very alone and isolated. So may we be the connectors. In Isabel Wilkerson's talk last week that was hosted by Nevada Humanities, she's the author of the book Cast, among others. The takeaway was about radical empathy. And can we each provide radical empathy for ourselves, for each other, for those we love, for our friends, and for those we serve. So again, it is with great love and respect that I welcome and greet each of you with all my heart. And may we do that for each other today and through the week. Taking another breath, grateful for our aliveness, for being here together. Thank you all.
Thank you, Lori. Thank you so much. I appreciate your leadership in this area. It's very important, and it makes my day on the days we have these meetings, so thank you so much. I did read a New York Times article this morning related to Las Vegas and the impact of COVID on our hospitality industry. They quoted an unemployment rate of 29 point something last April. I know from one of the white papers that the Gwynn Center did for us that there was at one time a 32% unemployment rate. We're still having pain points of folks accessing our unemployment system, finding rental assistance now that things have changed a little bit, a lot more people accessing food pantries still. We still have work to do. And I'm really, really proud of the Volunteer Financial Navigator program that Opportunity Alliance Nevada put together in response to this crisis and under the leadership of Lori and Kelly, and the truly heartfelt support that they provide to our community. So big thank you so much, Lori. And also right now, I'd like to introduce you to Deborah Loesch-Griffin, and she is a new board member for us. When I first approached Deb about joining our team, knowing how important the connection to the rurals is and just who she is as a human being, I was super excited to have the conversation with her. She wanted to take some time to think about it. She has a lot of other things going on in her life. And eventually she chose to join our team, and I couldn't be more grateful. And so as you can see from her bio in the agenda, she brings so much experience, information, education with her to our forum and to what we're trying to accomplish in Nevada as being part of the solution. And today we have a special extra guest, her husband, Sean. I'm so excited to have you both here today. So we're looking forward to hearing from you guys. We have a lot to learn from you and so much information for you to share. So with that, I'd like to turn it over to you and take it away. And you're on mute.
Yes, now we're not, hopefully. Anyway, I have to tell you, it's very rare that Sean is actually introduced as my husband. It's usually the other way around because I tend to be behind the scenes on most things. So that was a real different experience. Because anyway, I think I'd like to really try and pick up on Lori's phrase of radical empathy, because I think it is at the core of the groups that we're going to talk a little bit about with you this morning that are out in the rurals, but they do have a statewide influence, even though we'll focus more on what they do in the rural areas. And there are three, I will share my screen shortly, but I just wanted to say there are three groups that we will talk about, but our overall drive is towards a shared strategy for community health workers. So we're going to hopefully give you a little bit about that. And if you already know about and have experience with community health workers, I'd love to see thumbs up in your, however you can do that, in your screens to know. Yes, Lori. Yay. Okay. A few of you. I just want to see how familiar you all are. Okay. Well, hopefully this will be new information. Lori knows us, and Sean, I'm not the most keen as a presenter. I would love to be more of a conversationalist with all of you. So it's nice to have my husband and partner in this, because we'll be doing it as a conversation probably in many ways. That's how we run most of our working life as life work partners. So let me get to sharing the screen and we'll start this process. Okay. And I'll put it on slideshow. Okay, can you all see that? Perfect, okay. So essentially there's three groups. I actually realized I started this with the Rural Nevada Health Network. In the history of things, the community coalitions, particularly in our rural areas, came first and have driven a lot of, from the ground up, some of the things we'll share with you today. And then most recent to the picture is the Pritzker P3, and P3 stands for prenatal through age 3. And they're a collaborative statewide. That's, and all of these, as you can see, are really looking at the increasing health access, increasing health economies is a way that we've phrased this before. The Rural Nevada Health Network, they're all under the umbrella of building healthy communities. And some of the coalitions, actually the Healthy Communities Coalition of Lyon and Story that I'm most active with, actually put that into their name. But essentially they're all, if you're not familiar with rural coalitions, they are like a neutral convener. They bring a whole host of people together from agencies who are in the health and human services arena, schools, you work with a lot of them. They bring individuals who are either volunteers or members of community. So they are a really wonderful gathering place and space, if you will, for people to come together and share their wisdom and talk about how are they collectively working together to ensure that every person from 0 through as old as you can get, seems there's a lot of people getting older. They make sure that they are getting what they need to thrive. And that's really the bottom line for rural coalitions. The Rural Nevada Health Network is a group of primarily, I'd say, agencies, but they come from the rural communities, and I'll talk more about who that is in a minute. But they come from rural communities, but they also come from state agencies, because if you're not familiar with the rural counties, many of them in terms of health access are under state governance with the rural health clinics and
the public health system and the rural Nevada hospital system.
Mm-hmm.
So both of those function as kind of leadership arms in terms of rural public health.
Mm-hmm. So they don't necessarily have their own health districts. And so the rural health districts are governed in that way or overseen in that way by the state agencies and other networks. So we do have a lot of state agencies, and it's been an interesting journey with the Rural Nevada Health Network. It started, let me go to the next little slide. Here's the kinds of people that I put in there. And you'll see the first group I listed was community coalition directors and staff, because I would say they were the primary drivers of bringing together these entities across the rural communities, because if any of you have ever driven out and amongst the rural communities on Highway 50 and 95, you know that counties intersect and they have to share and use the same resources, and what resources they do have. So community coalitions often cover multiple counties. For instance, Healthy Communities Coalition covers Lyon, Story, and Mineral. They look at it as where's the highways and where are people traveling and how do we put the resources where they are. You'll see many of the other agencies there, but I think I want to stop here and talk a little more about the community coalitions, because I think if you understand a little bit more about their roles and what they're doing, and a couple stories that will help you understand the circumstances that they are dealing with. And Sean has been working with the Nye County Coalition. You want to talk about that?
Sure. So, and good morning to everybody. Those I see and can't see. Nancy, good to hear and see you. I've been working in the rurals for a long time doing coalition building, and it's much the same information that Debbie's just shared. It's a group of volunteers coming from many of these same groups. The further and more rural you get, the less there is of everything. You can start at healthcare, you can start at mental health, you can start at food, whatever the issue is. So I find it to be deeply rewarding. I find it to be deeply meaningful. The people in every community I'm in Tonopah and Pahrump regularly. I've worked all over the state, however. Find that, just having someone come is such a gift. I can't tell you how many times I've been told that they don't know we exist. They meaning everybody else. And when I'm in the legislature testifying on a bill to support community public health, for instance, which was cut out of the budget 2 years ago, they look at me and say, well, I thought everybody in Nevada has access to public health, or everybody in Nevada has access to the hospitals. And nothing could be further from the truth. We lost 2 people, 2 adults in the last 18 months in Tonopah because there was no public health and no hospital. So,
and not due to COVID.
Not due to COVID. So, the issues are real. They care about building a strong network of people who they can rely on, and they can smell a huckster a mile away. They've been told by everybody that we're here to serve and we're going to make your life better, and then the people are gone in 16 minutes. So, what they really depend on is authenticity and showing up and doing the hard work. And building community in rurals is so much different than it is elsewhere because there's just so little access, and you can finish the sentence any way you like to anything. So they're just grateful that you come. I'm grateful that you care. And I'm continually impressed by the good work that's being done up and down the state by so many with so little. And again, these are all volunteer coalitions, people like yourselves who are trying to shape the outcome of their community, whatever it might be, whatever indices you're trying to address.
Mm-hmm. And I think one of the things that makes working with them, I work more primarily with the Health and Wellness Hub that's associated with the Healthy Communities Coalition, is their can-do attitude. You know, Lori mentioned radical empathy. We have sets of guiding principles of meeting people where they are, kind of not giving up. So they really have shaped their connection with one another to say, together we can do so much more. But there is a strong belief, I think, across the rural communities that we have the resources and we need to leverage them and use them wisely, because they're not like the same access in urban areas, except I would say for those underserved communities in urban areas who feel probably much like they're isolated and out in a rural community. So it's really, we have a kinship, I think, with the urban areas in that regard. So you can see the number of people, and it's been such a pleasure. I mean, for me, I love facilitating. And when you get to work with a group of people who, like the Opportunity Alliance of Nevada, are so committed and they take whatever they can get and they make it work. Sean's group in Pahrump and in Tonopah, you know, they're, as he said, a group of volunteers. In Healthy Communities Coalition, they are agency reps. We get the school district superintendent and deputy superintendent who come in with the juvenile probation to, you know, Health and Human Services, to those who are what we're going to talk about, community health workers coming in. So there's a real sense of equity and equality in that group. Everybody has an equal voice there, and they don't stop until they figure out together what might be some ways to make things work. But it is always such an important part of their ability to thrive and continue on, by having others from the state come in and talk about resources and learn about them, as Sean said, to learn that they can do some things and they just need people to connect and collaborate, but not to come in and direct. And there are many examples where that is attempted, but thwarted, I will say. Okay, why is it not working? Okay, here we go. So this is a little history. The Rural Nevada Health Network started from a group coming out of the university, the Rural Hospital Network, our partnership, and folks in the state agencies who deal with epidemiology, and then our community coalitions. We all came together originally under a HRSA grant for planning, and when that expired and there was no additional funding, we all kept meeting. So now it's 7 years later, and we are continuing to meet quarterly, and we have really looked at what are some key strategies that will help people in the rural communities get connected to resources they need, and particularly to health access. And as you all know, and this is something that I will be really interested to hear your thoughts as you go through this and how this overlaps, but there's no single issue that necessarily drives how a person can thrive. Finances is huge, also health is huge, but what we know in our communities and we know about people is it's, as Lori was talking in the beginning, it's the social support networks. It's the fact that you need people to be able to thrive. And so the more we all on this call learn about what are those resources, who all cares about this, then the more we can really tap into and pass the baton on, which I think is an important piece. The community coalitions and the rural areas in particular, they all were meeting because that's what they did, because that was their time to come together. Some work in such isolation, they became the peer groups for one another and the collegial groups because they didn't have teams they worked with. And then they got, there was a point at which I don't need to get into that so much, but they all then officially became 501c3s in order to receive funding from the state. That was the bottom line. And so many of them started with the focus on substance abuse prevention for young people. That was what drove it, was the Bureau of Alcohol and Drug Abuse. But our rural community coalitions continued to work with a broad spectrum of players and stakeholders in their communities. They didn't just go into the substance abuse prevention and intervention. So I'm going to step in because I'm conscious of time and I want to really have a conversation here. And Sean and I have both been heavily involved in the Community Health Worker Initiative, and it's a shared initiative now. It's almost like the time is right. We've been at this since 2014 with the state and Department of Health and Human Services and with several other entities and Medicaid. And finally, it feels like there's growing awareness about the role that a community health worker can play in not only rural Nevada, but in many other kinds of underserved communities. So really community health workers are paraprofessionals. In some ways, every time I hear about the volunteer financial navigators, it brings up that recognition. And so there's a parallel there, although I think it's different because those who serve in that role in OAN have a very deep knowledge of the finances necessary. But community health workers really, we call them the trusted allies and bridges. That's been you'll hear that if you get in with people who are using them in their services. But they are there to connect people. So they have to learn they usually, ideally, come from the communities that they're serving so that they understand and already have strong networks. And there's a formal definition for what a community health worker is because they are a recognized profession. This is not just a Nevada thing. This is a national effort. It actually started out of Texas and New Mexico. And in New Mexico, it was the promotoras who lived in their communities and were very much sort of peer support people who were trusted. And so they were able to take and translate very important health information and educate their peers, families, other mothers, other parents. And that's a lot of what the community health worker in Nevada does. They're frontline, as Sean said, they're a public health worker. And they are not degreed. Some of them do this voluntarily. We have AmeriCorps members who are trained in this. We've even started some out of high school. So they run the gamut in age, in roles, and the important part is to connect them to those groups that they are already familiar with and build from there to get them into the resources in their communities. So you can see this definition. It's really, we'll show you these settings they work in. I'm going to do this more quickly so we can move to the conversation, but they work in a number of settings. And interestingly, community health workers in many states are much more known to be working as members of medical teams. But because our community coalitions were such drivers in the grassroots level, community health workers in the state of Nevada really are out in community and affiliated with nonprofits and community coalitions a lot. So you can see the bulk of them in this particular diagram. They have a basic training that's offered, and it's offered through through Truckee Meadows Community College, College of Southern Nevada, now CASAT at the University of Nevada, Reno is also doing some of the trainings. And then there is a hybrid statewide course that the Association for Community Health Workers offers as well. And that's much more accessible to people in the rurals. We worked long and hard to get that so people could have a common foundation and understand their role. Apparently you just have to click the screen. Okay, and this gives you a sense of the counties in which CHWs work. Clark County, you can see where normally with the population would have the largest, it does. Clark and Washoe do. But then you can see Lyon County, Nye County, Churchill County, they stand out even though their population may not be that great because those are the players, those are the directors of coalitions who really jumped in on this and continue to use them very actively. And this was from 2019, so there's been a lot more folks out there that have been trained. We're building a workforce that can really help us, and I think they are a valuable resource to OAN as well if you all can get to know them. So this is the thing that makes this very challenging and hard. So if you didn't know what a community health worker is, I'd invite you to look at this list of titles and see who are these people? And do you know any of these kinds of folks? Because they go under many titles. So building a sense of an identity for individuals has been really challenging, but I think we're getting there. And the biggest way to do it is through employers. and through neighbors and other groups, so that they can really recognize that there's a workforce, that if they have people with this type of role, that if they can get them to all join, we can have a much stronger, I think, mechanism to really bring them up as a viable statewide workforce. So I'm interested, just looking at this, and I can't see all of your faces, so that won't work. Never mind, I'll get back to that after we finish this. Sean, you want to add anything about the community health workers at this stage in terms of what you've...
So there, we have, for instance, a community health worker working at the middle school in Tonopah, and I like to think of them as being the connective tissue in the community. They're working as an AmeriCorps volunteer there, trying to coordinate services at the school, trying to get the students connected to any community resources. That could be, as I said, mental health, public health, food, sometimes shelter. Also trying to keep them connected in terms of advocacy. So if there's something going on in the family, in the community, they're the voice for that person.
Mm-hmm. So this was a study that was commissioned for the Center for Program Evaluation to look at the value added of CHWs. And again, this was specific to the clinical settings in which CHWs have been assigned. So we saw Dignity Health was one, for those of you in the Las Vegas area, Community Health Alliance, other from federally qualified health centers to hospitals who have used CHWs. The challenge for many of these systems is that there is no reimbursement model for CHWs, and that is now in front of the legislature under AB 191 to at least get those who are working in medical settings to be able to be reimbursed as team members of a medical or a health team. But they found that it was nearly 2 to 1, $2 was saved for every dollar spent. And in particular, some of the things that a community health worker can do is to reduce the use of the ER visits that people have, or urgent care or acute admits into places, to get them to be hooked into a primary care or a health professional that they trust and begin to take charge of their health, essentially. Which in a sense, I always feel like health and finances are very intricately woven. So that's, we have just one study at this point, and we have looked at other ways we know the benefits just from the stories we've heard of CHWs who are in other settings, and particularly in schools now with the social work bill that was passed a while back. They were given leeway to hire community health workers as resource coordinators in lieu, especially in the rural areas where licensed social workers are not exactly abundant. So this gave them a chance to work in school settings and hook families and kids. And so they work primarily with the families of students who show up on the radar and help their families connect to all the different resources, so that helps stabilize the student and the home. So these are the groups that are CHWs. You can see that. And one I haven't talked so much about is the most recent on the scene. It's the Pritzker Collaborative, and they are a statewide group of folks focused on prenatal through age 3 and looking at the value of putting community health workers in hospitals. So this isn't just restricted to rurals. This would be statewide as well, and in underserved communities, including our tribal communities, and putting them into hospitals where at birth they become a first touch person and really assess and screen and form a relationship, and then help them as they transition home. And in some cases, maybe transition to a home visiting program where the families might need extra help. But they are really I call this group a powerhouse group too. Pritzker Foundation, Nevada was one of, I think, 11 states that got funding, and they just got approved for their implementation plan. But they're mostly on a policy level and finance level to try and put things together at the legislative level and in systems to be able to support the kinds of things we know are needed for families and children at the earliest ages. AB 191 quick summary requires the state plan for Medicaid to include coverage for the services of a community health worker under certain circumstances. That's very interesting language. Mm-hmm. Our group, this is an example of the kind of commitment, the radical empathy that people have. Last weekend, I get text from my dear friend Steve Messenger at the Nevada Primary Care Association saying, Deb, we have a session on Monday that we need to gather people together and we need to get our act together. So I texted, people were ready. They got together on Saturday at 5, had a session, built their platform and their presentation. And I heard Monday, it was wonderful. They did a great job. And it was almost like, as people described it, a no-brainer, which it should be a no-brainer, but for the last, how many legislative sessions that we've tried to test? Three sessions. It was like they couldn't get it. They didn't know what a community health worker is. And I did share with Linda the booklet we put together finally, because we realized people just didn't understand who this workforce was and is, and they're mighty powerful. So I hope, and now I know there's a video, certainly we can show it, but I'm conscious of the time and I want to make sure we have some time to talk to you, but I really want to hear from people in terms of what you see as the crossover with the Opportunity Alliance of Nevada and what possibilities, because the more we get people connected and aligned and really advocating together and sharing the voice of the importance of not only the rurals and the work that the coalitions are doing there and the health network, but also the community health workers that we're all kind of pushing on the scene. So I'm going to stop this share so I can see everybody. Anybody have questions they'd like to put out or comments?
So this is Linda, and great information, deep information. I'm very familiar with community health workers, but not necessarily how they were working in the rural coalitions. I'm gonna pause, and I'm gonna let anyone else that has a question or a comment. I know we have Tiffany Husband from Clark County Social Services, and Holly from a health plan that's Medicaid, all kinds of folks. Diane Orgill from the Red Cross, several of our board members. So before I launch into anything I have, I'd like to open up the conversation to others. You can either post it in chat or just unmute and jump in. Well, it was a very comprehensive presentation, and you know, Deb and Sean, I see so many crossovers to our Volunteer Financial Navigator program. Lori, do you have something you want to add, or do you want me to just, you go ahead. I think you and I probably have the same or similar comments.
Thanks, Linda. Well, first of all, I had the privilege of being with both of the rural coalitions over the last week, Tonopah and Pahrump, and expressed, our work with Opportunity Alliance Nevada and talked about Bridges Out of Poverty. And they were very interested and actually remembered some folks about our Bridges training there previously. And for me, the connection is exactly, and piggybacks on a conversation that I had with folks at CHA in Reno, that not only is it who we're serving in the communities, but the employees themselves of these organizations to help with, financial stability and financial well-being through the what OANV offers, connecting the coalitions, both community health workers and staffs of these agencies with tools for financial stability to work with spending plans, et cetera, as part of their whole wellness.
Mm-hmm. Thanks, Lori. Yeah, I think that there is so much, you just have to think that this kind of person can go anywhere, whether they're in affordable housing units, whether they're in hospitals, whether they're in childcare centers. But the more I think you all can get to know who are those folks in communities, then pass the baton on or connect with them so that wherever the families and the individuals live that you're serving through the OAN can have someone that's a trusted ally in their community. Tiffany, I think you're unmuted now.
I'm unmuted now. Good morning, everyone. So I'm with the Division of Welfare and Supportive Services, so it's the state of Nevada, and I'm the manager of the Homeless to Housing Unit. We do the administrative support for the Nevada Interagency Advisory Council on Homelessness to Housing. It's put together under AB 174. I'd love to connect with you. We have a couple of kind of have a side project going that I'm not at the point of announcing anything about right now. But I think that there's probably some links there. And then also I'm trying to put together some of the kind of grassroots boots on the ground people to speak for the technical assistance subcommittee that is part of that council. So I really appreciate you guys talking this morning, and I am interested in getting more information from you.
Okay, Tiffany, is there a way for you to, I know the DWSS at nevada.gov, but it was a T-husband?
I'll put my email address in the chat.
Okay, thank you so much.
Thank
and
you.
I can put mine in there too, so that you can contact me directly.
Perfect, thank you.
I'm happy to share your guys' information if something goes awry as well.
I would, I know that time's getting short. I would just really love to encourage all of you to track and advocate along with our groups that we've just shared about, the AB 191. Our Medicaid group has been really helpful in the last cycles. They are working alongside the Rural Nevada Health Network partners who are making these testimonies and presentations. And so I think we're close, but it would be lovely to get the support, because it's going to be a game changer for many of our health clinics, because some of them have had to drop that particular staffing because they run on a different model and they don't do grants and those kinds of things in the same way that coalitions do.
Can I just add one thing before we say adios here? So I don't think I really said what it is, how we do what we do in the rurals, and for me, that's working on a paradigm shift, and that's where I think the greatest connection is to the work you guys are doing, because in every community that we're in, the first words out of their mouths are, we don't have, and you can fill in the rest of the sentence. And so it's teaching people to think differently about what they do have and changing the community with what the tools that they do have. And that is how you work as well. And so the example I always give is that, 20 years ago, sheltering people in Northern Nevada and Southern Nevada was unthinkable. I was laughed out of every room I went in to speak about homelessness, laughed out. In the legislature, in city councils, wherever I was. Now it's accepted, and that's a paradigm shift.
Yeah,
it's not only accepted; it's intended. So those kind of things happen if you teach people to think differently, and if you teach people to think differently about their money and their money management and their place in the economy, like they have a force and they have a place, then things work. And so then now, flash forward, when we started in Tonopah, we had virtually no mental health services, no food, fresh or otherwise, in the shelter, in the pantries. Virtually, public health was cut out of the budget one session ago. So they only had one public health nurse, and the hospital was closed. Youth programs, the same thing. So all of those services now are not only available, but abundant and working. But it took everyone seeing the situation differently for that to happen.
Yeah.
And that's true in every community I've worked and lived in. In our own community here in Virginia City, when we started working in a nonprofit, everybody said it was impossible. You couldn't do this, you couldn't do that. And that's just not true. But wherever you are, whether it's at home or abroad, things change when you see that vision being differently. And people are afraid of change. So they want to hold on to what they know. They don't want to let go of that. And I get that, but you have to walk with them.
Yeah.
And it's through their own fire that you have to walk and get to that other side, so that they find that they do have the strength they need to make whatever change it is you're trying to do.
I couldn't say any more eloquently, but really a strength-based approach to community development. That's what I think all of the groups that we have just shared about, that we adhere to that. I don't think we, the two of us, would be participating in any of them if there wasn't that particular focus, because we are driven by possibilities, not problems, personally. Problems weigh us down when you do what OAN does, create possibilities for people where they can see a road in front of them and they know they have some strengths to navigate it, it makes all the difference in the world. Thank you for letting us. I will send the link for the video. I guess that's, I don't want to take people's time beyond.
And Deb, I'll put that in the notes when I send. Do you mind if I share your deck as well?
Oh, absolutely.
So I'm going to share in the booklet. So we'll be sharing a lot of information on the follow-up. And I just have a few observations. I couldn't agree more with how eloquently put Sean just painted that picture of how far we've come in a lot of areas. There's still work to do. We will be providing support and written support for AB 191 like we do on other what I call asset building policy. It definitely draws the health wealth connection, which we know exists. Mm-hmm. I just want to mention again that when the HRSA grant expired, this group of folks became volunteers and continued to promote the mission of what they had started, and what they've accomplished is just amazing. We've had very little interaction except with, with Deb and Sean being our leaders, because the rurals do require a trusted ally. My best understanding is if there's not a trusted ally, your road's going to be a little tougher getting connected and letting them know maybe what exactly you have to offer. So we choose our team carefully, and that's why. I do think there's a lot of connections between the community health workers and our volunteer financial navigators. I think there's a lot of ways that we can collaborate and synergize what we do and support our community, our rural communities. Mm-hmm. So before we leave, I just want to make sure, does anyone else have any questions, comments, anything you want to share with Deb and Sean? Okay, well,
I love Lori's quote in the chat. The real voyage of discovery consists not in seeking new landscapes, but in having new eyes. Marcel Proust. Got to read that man in French, and boy, he can go on and on. Thank you. That was a lovely quote. Good reminder.
So I found so much value in the presentation today. I learned a lot. We look forward to being supportive, and as Lori and I like to say, we consider OANV the table, and so that we can build these collaborative statewide relationships. I'm so glad that Tiffany Husband and you guys will be connecting. It's what we do. It's why we're here. So again, thank you. Thank you all for being here. Thank you for your time. Thank you for supporting OANV and our collaborative partners. And we hope you have a wonderful Friday, and we'll see you again in 2 weeks.
Thank you, Linda.
Thank you,
Thank you, Lori. Thank all of you. It was an honor to be able to share this work.
Thank you.
Thank you. That was great.
Thank you, everyone.
Great presentation.
Mm-hmm.
Thank you.
Bye.